though, which is good. Yeah.
You got a Facebook page going?
Yeah, nice
I
work.
mean, I gotta like pay attention to it though. Like Megan did it. I'm not gonna lie. She just took off my plate and actually got it set up. She runs or she's an admin on the official pages, which is awesome. And yeah, we got that going, which is gonna be good.
Yeah, I'm just waiting for the approval of, because I went ahead and sent a request to it, so I'm just waiting on that.
Okay. All right. Did they? Yeah, I think you have to. Yeah, I think it should have gone out through the email as well. Just like.
That's what I got.
Okay, cool. And link on it, and I've tried to accept people who are asking to be a part of it, but I think that I run a couple pages, so I think that I get confused. So we'll get Megan on it too. She's better at it.
Right on.
But all right, here we're missing. We got a few people here. You give it just a couple more minutes. I'll put us about 5 minutes after, and then we can get started. We got some people who have told us they can't make it because of the change. I mean, normally we're on Fridays, right? So some people can't. 1 second. Yes, Megan. All requests have been approved.
Coolness.
That's service. Complain enough, we'll get it done. That's how government works. Oh my goodness. Maybe we got on a call. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, cool. All right, we'll just start the meeting off, I guess. Or any comments or any opening suggestions, anything for the good of the body, just kick us off. Everyone doing all right? I had to take a corona test today. So, has anybody done those?
Yeah.
Yeah, so you have, so it goes straight into your nose and they actually go like back into here. Like,
Wow.
yeah, it's anyways. But I went to a lot of rallies and stuff this week, so I want to make sure we're good. But for those who are wondering if, because it's not really on our agenda or anything, but to get a test, if you think you've been exposed or just want to know, you call 211, and they will it's United Way, and they'll set you up with the county health department, and then you do a drive-through test. So if you know anyone who's asking, or any of your coworkers or anything, or employees, if they're worried about it, if they feel like they have symptoms or feel like they were exposed, it's free. It takes a couple of days. It took about 2 days. It takes a couple of days. All right. Cool. I think we're good. Let's go ahead and get started then. Has everybody had a chance to review the minutes?
Yeah.
Are there any suggested changes? I think Groover Labs was misspelled, and it was spelled as something else. But I think we got that. We're getting that taken care of. But other than that, any suggestions or comments on the minutes? If not, let's go ahead. I'll make a motion to approve the minutes. Is there a second?
I'll second.
Motion was made and seconded. Any discussion on said motion? See none. With that, all in favor of said motion, please respond with aye. Aye.
Aye.
All opposed, same sign.
Aye.
The ayes have it. The motion does pass. Minutes are approved. Onward to the agenda. So following up on actions, you guys all got the agenda, right?
Yeah.
Okay, I don't want anyone like, what is he talking about? All right, the actions for May 29th. We wanted to reach out to the Hispanic Chamber of Commerce and the Young Latinos, and I think Wayne brought that up. Wayne, did you have a chance to reach out to any of those organizations? And if so, what did we find?
I did. Good morning, everybody.
Morning.
Had the opportunity to visit with Alicia Sanchez of the Hispanic Chamber, of the Wichita Hispanic Chamber, and had a really good conversation. Are you guys hearing me okay?
Yeah, it's echoing a little bit, but I think we're all used to that. So with this technology.
And I'm wondering, I can put on my headset really quick if that's okay.
It might be us. Let me mute mine. If we go mute, because if you're coming in someone's speaker, it might be going back through their microphone. So if we mute while you talk, it's probably going to be better.
Okay. All right. So met with Alicia Sanchez, and here are a few takeaways from that conversation. And by the way, Alicia is not only involved with the Wichita Hispanic Chamber, she's also involved with the young Latino professionals of Wichita as well. And so we had a good dialogue. And basically, she identified that the Hispanic community has a lot of fear related to COVID right now. And there is a lack of accurate messaging. And so that's something that they certainly needed help with, just with getting the word out about resources, that sort of thing. And particularly translating a lot of information into Spanish. More testing obviously is needed for Hispanic businesses. Actually, while Alicia and I were having a discussion, we pulled up Sedgwick County's website and we took a look at the dashboard. And if you haven't had a chance to take a look at that, I encourage everyone to do so. But one of the things that stood out was the significant, there's a big difference in the number of Hispanic individuals that have been tested. They actually reflect some of the data by the demographics. And so anyway, right now they represent about 10% of the overall testing that has taken place. And but they account for, and minorities in general, account for greater percentages of positive tests. So just something to be aware of. And that was, again, information that she felt needed to get disseminated better throughout the Hispanic community. And so as we talked about how do we help educate the public, we talked about things like more opportunities to do, kind of outreach, Zoom calls or webinars around some of the various services and resources. And so what I committed to with her in that discussion, this is just, one example, we're going to do a call with the Hispanic Chamber on June the 18th, and where we're going to talk about the Paycheck Protection Program that the SBA has right now, and then other resources that we have available to help. So that was the extent of our conversation. But again, talking with her, she actually represented both organizations that we wanted to connect with. And I would strongly recommend if there's room to add another individual onto this committee, I would strongly recommend Alicia. She's great. She's also actually her role at Wichita State, I believe she's involved in their office, or the director of their Office of Diversity and Inclusion. So that's it.
Do we need more documents that are in Spanish for COVID? I do have a partnership with El Centro out in Kansas City, and they might have documents available that we could share with our community.
That was definitely something that she identified. Yes.
Okay. What about these? What about these testing centers? Have they been advertising anything in Spanish? Do they have Spanish speakers out there that are doing these tests?
So that's something we would have to follow up with the county on, because this falls into their lane. Okay. And that's something that we can do for sure. Kara, did you have a follow up? I think that were you.
Oh, I was just saying that, so I have a partnership with El Centro in Kansas City, and I know that that's their big focus, is making sure that they have documents that are available in Spanish, and helping translate documents as well. So I can reach out to them and see if they have COVID documents available that we could disperse out.
Definitely. Let me also double check with Lacey Cruz over at the County Commission. I do know that I think Spanish is one that they were looking to cover, and I think Vietnamese. In our Wichita schools, we have it, and Ian's not Wichita schools, but he kind of, I think, probably knows the stats. So correct me if I'm wrong. I think we have like over 60 or 70 languages that are spoken. So it's one of those where we want this information to be put out, the accurate information, because there's so much fake information out there about the coronavirus. And one of the things early on in this, there wasn't enough of that. So I tweeted out another small city from California that had just like 108 languages of good information. But it's something I think we did lack on early on. So let me do a follow up too and see if the county does have, as was mentioned, Spanish interpreters who can talk with people, answer questions, or Spanish, not interpreters, Spanish speakers while at the testing sites. Let me look into that a little bit. But also, if we don't, if Kara can kind of follow up and see if there's templates or documents that we can utilize if we find out there's just not enough, that the county's not doing enough with it, then maybe we can complement them on the city side by getting some information out.
Okay.
Any other discussion on this one? Eddie, do you have anything else?
No, I was just wondering with the Spanish speaker and the test that you did, it's free. Am I correct, or is there a fee?
No, it's free. So there's a couple of things going on, and this is very important. If you're on Medicaid, it's free. If you have insurance through us, like at the city level, it's free. I'm not sure about other insurance, but I do think that I think insurance providers get refunded for the test. But if you have no insurance at all, it's the drive-through that was done over, and I forget the name of the organization. It's one of the three like nonprofit medical organizations that were up on 21st Street. I think it's 21st and Oliver.
Go ahead,
Mr. Bell.
Was it Hunter Health Clinic or?
Not Hunter, one of the other ones.
Health Corps, right?
Yeah.
Health Corps.
Health Corps, yeah, one of the cores, yeah. But it's Hunter Health Corps, and I think one other that are kind of our community, community health nonprofits. That was completely free, no questions asked. You just line up. Now the county, like I said in the beginning of the call, you call 211, and they will go through a list of symptoms to see where you fall, as far as priority. But they will hook you up with a drive-through test. So I got to do that today. It'll be like my second test. So I'm going to probably go live and talk about that experience, like how to do it to try to get awareness out. But it's just 211, and they will have you show up at the health clinic, and then you drive through, and I think it's like a tent that they put you under, and then they take a 4-foot long stick and they stick it in your nose. So that's how it goes. But more of the story, absolutely free. We should be encouraging people to go through this terrible and awful experience. Any questions on this item? All right, cool.
I hope you don't sell it like that.
I know, right? Like, no. Brandon Johnson and I did the one up north, and they had the camera in our face, and then we're like, oh, like Johnson, like they got really in there on him. And anyways, and then you're trying to like hold it together and tell the camera like that wasn't so bad. Everyone should do this because you want more people to get tested. But it took like 2 days. I felt like I got like punched in the back of my brain. Anyways, it wasn't terrible. It's just definitely uncomfortable. It's new. Anyways, since these are being recorded and going live, I'm not going to knock it too bad because it's definitely. I want more people to get tested. I think we all do, and it's important. Okay, so contact is what?
Is this the test just to see if you have it, not to see if you have antibodies for it?
Yeah. Yes.
Okay.
Good question. This is just to see if you have it. Now, Health Corps actually had both. They offer the antibody test and the swab test. There's some problems with the antibody test. Like I guess, and maybe they improved it since then. That alone isn't enough. You get, I think, a lot of false reads with it. I think you're supposed to take like 2 types of tests to kind of cross-analyze the data to see if you had this before. But I do know the antibody test is available in some of the best science. We're learning a lot about this virus, and I'm on calls and stuff learning more. is if you had this before, like it doesn't actually mean you won't get it again. You just might not get hit as hard, but if you get it again, you can still carry it. So it's you might be okay, but you might still be contagious if you get it again. It's really this weird. It's a super bug, and it falls into the same family we think as as the flu virus, but as the cold virus, which tells you a little something about how nasty it is. Where the flu we can actually control, right? Like we have vaccines for the flu. It's predictive. The cold, there's no cure for the common cold, right? Is what mom tells us. So it falls into that category. This really kind of super nasty, very contagious bug that's trans-species. It affects cats and bats and us. So we're hoping it doesn't get worse, but we're still learning about it. Like if you have it, if you did have it, so if you go and you get the antibodies, for example, and it just shows you have it, or let's say you did, you should be watching out for blood clots, right? Like, so still go to the doctor because they're finding out that afterwards, people are actually having strokes or heart attacks because they're finding out that their blood is more susceptible to clotting. So like little things like that we have to we're still following, we're still learning about this virus and its effects. And for those of you who work in the service field, if you have customers or, or your employees I had that, but I got over it, it's okay. Like that might be the type of information you want to pass on where, okay, well, still see your doctor, go see your doctor, still make sure, get your blood tested, make sure that you're not getting some of these other side effects that could be a problem. And this is all secondhand, by the way. My doctorate is useless. Like I'm not a medical person. So this is just what I've heard. So please, if you have questions, talk to someone who actually went through medical school. All right, so I'm gonna get to my next item. Is no more questions on this one. So my item was to contact I had a few items. Contact the library for potential tablet loans. We did that. We found out that the library does not loan tablets outside of the building. You can loan them when you're in the building, and you can kind of go to like a secluded area in the building, and you can utilize the tablet that way. As a follow-up to that, though, I did find out that through a grant program with the AARP, we actually loan out hotspots at our not at our library, but at like Atwater, at some of our neighborhood associations. So when it comes to having access to the internet and maybe not tablets, we definitely as a city do loan out hotspots right now through a grant. So that's something we might want to keep in the back of our pocket in case there are people who want to utilize that technology. And I'm just going to go through a few of my items just to knock them out of the way. Any questions about the tablets?
What would be the process of them getting a hotspot?
So that's a good question. I think they would just contact Atwater. Atwater would be one of them. And I can have D look up some of the other ones that do. But I know Atwater was kind of the example and asked about the process. I don't know if you have to live in that district or because a lot of these centers are kind of district centers. I don't know if there's any, like you show your address, shows that you live here, and now you get a hotspot. I'm not sure if it's geographically restricted. That wouldn't shock me, but also, I think it's more you get a hotspot when you show you're a resident, you sign it out for a certain time, and if you don't bring it back, they probably shut it off and probably give other ones out. So that's probably how it's working. I'm not 100% sure, but I do know we have it. So that was something I found out this week.
Good to know. Thank you.
Yeah, of course. All right. So the next one is explore options for bridging the divide for community members not using social media. And I think that some of that was printed material as well. So we're still looking at other ways to do that. 211 was one of our hardline ways to try to get beyond the internet, but that's still ongoing. Did anyone have any feedback or any ideas on that, getting to people with beyond social media? All right, cool. That's still, I think, an ongoing one. So Mr. Bell's on for the next couple. I'm just going to go through mine, though, then we'll let Mr. Bell go through his, and usually it goes quicker than bouncing around. So let me just, we did discuss availability of PPE for small businesses, and checked out Groover Labs to see if they were on the list for locally made stuff. And also we are trying to, during our last discussion, update the city website, because we talked about how like we had all these different web resources, but you kind of need to know where they were. And we're actually working on integrating some of those to our website with the links to those. And I think Megan wanted to show us how to do that a bit better. Megan, are you? Yeah, can you jump on and just kind of give the overview of how we switched up the website a little bit and what we're doing with there? Yeah, and this kind of gets into the second point too. Consider placing a master list link of everything on a website. Discussing the available PPE, local resources. We wanted to make sure those local resources also are on that website. So we've combined that a little bit, and we can go back to that item to talk more about you guys' experience trying to find PPE and if the local websites have been enough. Oh, hi, Megan.
Hi, guys. How are you?
Wonderful.
So Dee mentioned that you might have some questions about resources for businesses and individuals out there. We have worked with some of our community partners to sort of gather some of those things. So if you don't mind, I'll take just a few minutes to do a screen share and walk you through what's already out there. And then if you have other suggestions or needs, just follow up and we'll see if we can't work with our partners to put something together. So I'm going to start sharing my screen now. I've never done this before, so bear with me. Oh, hey, Dee, I think you're the host. Could you enable participant screen sharing for favor?
Yes, hold on just a second.
Thank you.
And while Megan's doing that, I just thought I would tell you about the free Wi-Fi hotspots. Residents can check those out at 3 different neighborhood resource centers. And all you have to do, they can have it for 2 weeks at a time. You just need an ID and proof of address. And you can get that at Atwater, Colvin, and Evergreen neighborhood resource centers. And all that information is on our website. And I can send you a link, or you can just go to, I think it's just WichitaOnTheCheap.com gives you that information too. So.
Thank you.
All right, so I'm going to start screen sharing, and I'm going to show you the easiest way that I know of to access this information, which is through a portal on our own wichita.gov website. Can everyone see my screen?
Yeah.
Okay, perfect. So if you go to the website, we've removed all of our regular banners except to focus on coronavirus and census. So we have 2 options right here: get updates, which is our daily news updates, and our own reopening plans that we update every single day with added numbers and any changes or requirements for entering city facilities. The second one is resources for businesses and individuals. So I'm going to click on there. So this is kind of a beast, but there's a lot of information. So we have 2 categories: businesses, individuals. So it comes from unemployment to SBA loans, USD 259 meals for kids, learning resources. So you can, I'm just going to scroll down just a little bit. You can explore this on your own time. But one of the things I think was specifically mentioned was like PPE and things locally. So we worked with the chamber to put together a resource page for resources for local businesses. And if we go here, sorry, there's a lot of clicking. So on their resource page, you'll see phase plans for reopening. And then we also have supplier information. And it gives you a full list of all of the things that businesses would take reopen for customers. And this gives you contact information for all of these areas that you can reach out to, everything from cleaning supplies to face shields, disposable masks, cloth masks, and it's constantly being updated. So if you know of someone or a business that's providing these things, please reach out to the chamber here and you can get added. And you can reach out to any of these companies and they can get you hooked up, oftentimes work out a deal with your business to provide you those things at either wholesale or bulk ordering. What else did you guys have questions about? Resources for businesses.
Also, any suggestions? Is there anything else we could do to make this more complete or easier to find, or what? You guys are the ones kind of out in the field. We're talking to small business owners. Is there anything else that you're hearing from maybe your peers that we can do to make this better?
I think on the social media pages, if you could just put like a screenshot of each page, that way, post it like every week or something, just so people know, instead of just sending them straight to the website and say, look for it. That way they can know what you can find on there. I think that could help.
Yeah.
Hey, Megan, do we have anything pinned on like our Twitters or any of that? Like, do we have like a message pinned or?
We do. We've changed it right now to a feel-good picture, but we can definitely pin these sorts of materials as well.
Okay.
We like to change those out fairly frequently. Also, make sure you check out the Chamber website for these business loans, grants, and financial assistance. We're still hearing from individuals and businesses that just call the office that their loans haven't gotten through. They're still having difficulty getting people to come back to work. So make sure you check these out. There's a lot of variety of resources depending on what your business is or your particular needs.
So as we go on for the next week or so, before we meet again, please feel free to comb through these sites. And if there's anything that needs to be added or changed, let us know. We can update that pretty quick. I thought it was going to be higher hanging fruit, right? It would be tough to add all this to our website. Turns out it's not. Turns out Megan can do that on like a 15-minute break. And so it's pretty easy to adjust and make it better. So, please give us some feedback on that.
Yeah.
And I do know that the county has their site up, and I think as Wayne mentioned, it's really, the dashboard's really cool. It's as far as like presenting the data and what's going on with the progression of the virus, but this is more, I guess, service based on how do we respond to the needs of the community as we go through the pandemic. So we want to keep it more focused on that type of stuff where we complement the county, but there might be some confusion where, I went to the county site and all I got was numbers on who's being infected, or, this one's more about, other products. So we're trying to get the information out, but also make it, I think, a little more clear and concise on what, whose role is what. So any questions for Megan?
I actually have a question. Can you hear me?
Yes,
Yeah.
ma'am.
So just like how Megan did for us, where she clicked around, because she even mentioned there's a lot of clicking. Is there a way, like, on the social media for even just like short little videos where it's like, are you looking for PPE? Let us walk you through the website, just so that then they can see like, oh, go here, click here, click here. Maybe that might be helpful.
Yeah, we have shared
that it's so overwhelming that you're like, oh, geez. And then people kind of shut down. That maybe, like when you did this, I was like, oh, that's pretty simple. You can go there. That if they saw the visual of it, that it's not that overwhelming. Maybe that might help too. I don't know.
I will say the mayor actually helped debut this on a Facebook Live that we did. And the chamber has been doing those videos and those information. So if you're not following the chamber on social media, definitely do that. But we'll be sure to share this as well more frequently.
That's a good point.
Okay, thank you.
Kara, give me 1 second. Let me just finish this thought. Let me see if there's maybe like small business loans or PPE or something like the main like topics. Maybe we can get some 15-second, 20-second videos about how to where to find it. Maybe I could do some of those. If some of you want to do some too, that's cool. Yeah, good point. Where I think that particularly for folks who might not use a lot of the internet, then I'm thinking about like older business owners who the internet's more just for email and business purposes. Helping them navigate through is probably pretty smart. So that's good feedback. Kara, I didn't mean to cut you off. I saw your hand go up, but I was already mid-thought and I knew I'd forget it.
Yeah, you're fine. You're fine. I was just going to kind of follow up off of what Megan just said there. Have we been like telling people to follow the chamber and things like that? Because like I know I follow the chamber, and I'm sure a lot of the people in this group follow the chamber, but does our community know to go follow the chamber? So just different things like that, so let them know like this is definitely a resource that you want to have available to you.
Definitely, we'll be sure to remind people. Also, the Greater Wichita Partnership is also a good option. They're here to help stimulate our economy and make sure businesses are strong. So they've done some of that as well. So we'll be sure to promote those two resources.
That's a really good point. Where until I was elected mayor, I really didn't fully know what the lanes were for all of our partners. But everyone in this building, it's obvious, right? Like you live in this culture where like, yeah, you go to the partnership for that, you go to the chamber for that, you go to the county. So, but I think we take that for granted when we kind of work in this world. That's really good feedback that it's not everyone does that. So let's work on ways where we can, I think, promote those who we've kind of tasked, our partners that we tasked with certain tasks, helping with this, because you're right. I think they're probably just shooting this out to their following, but there are people who don't know to follow them, who are following us, thinking that's our role to put this information out, which, it probably is, but we do this private-public partnership with, we try to get stuff off our plate. So they're probably waiting for us to do it, but someone else is already doing it. And unless we start kind of integrating that, then, we could have holes in our information. So that's really good. That's really good feedback there. Any questions on this item or on the website? And if not, I'm going to get back to Wayne for his next two items. And I apologize for jumping over stuff. I just, from running meetings for the last like 10 years, I've learned that usually if you can bunch things up that are kind of related, it helps with time. So, see no questions.
Mayor, can I have one more?
Here? Are you okay?
Sorry. And then I'll kick off and let you guys continue. I would also encourage everyone to follow the community foundation, as they're working on a campaign to encourage the community to wear masks. And as we begin to reopen, it's important that we encourage people to be safe so that we don't see a resurgence and we have to shut down our economy again. So that's my last push, and I'll sign off. Thanks, guys.
Thanks, Megan.
Thank you.
Just a quick
Mayor,
yes, sir.
I'm sorry, Mayor, but before Megan leaves, I just wanted to, for her awareness and everyone else, so the chamber is also, along this lines of resources for businesses, the chamber has assembled a task force to further help with, what business owners ought to be considering in terms of, awareness around CDC guidelines. How should they be operating, in this COVID-19 environment? So the task force is going to take it a step further, and there will be additional resources around all of those things. The social distancing that businesses will have, how will they be able to comply with that? What do they need to do? That sort of thing. So anyway, I thought might be of interest to Megan and certainly everyone else, and we'll keep you aware of that as well.
That sounds amazing. So it's like best practices.
Yes.
So like they're bringing in people who work in the bar industry, work in a different industry, and then saying, okay, these are the best practices. How do you guys feel? Making adjustments, and then we can get that information out.
Absolutely.
That's very important to know, because we'll definitely pump that info out, because if not, everyone's reinventing the wheel, and there's no consistency, and we might not be as effective. So that's actually very
and if Megan, if you want to reach out to Gary Plummer or Angie Elliott, they could probably get you plugged in, or at least keep you abreast of what that committee's doing, and then how they hope to get it out to the to the public.
Perfect. I'll reach out to him.
Yeah.
All right. Thanks, Wayne. Thanks, everyone. Bye-bye.
So just on that note, I will say that when I'm on the phone with our hospital leadership, we do see a fluctuation in numbers that you can correlate with, like, Mother's Day. You can correlate pretty much with people. It's about 2 weeks later, 2 or 3 weeks, when you see people kind of having big gatherings, or you call it like kind of cheating, right? Like, we'd social distance for so long, let's go out to this one thing. We see bumps with those. So as we move forward, we might see, and the paper report on it, I think we're kind of numb to the reporting right now because we see numbers go up and down. But there has been a correlation, with people getting together and the ups and downs in the COVID numbers. So it's still in our community, and I think that we should be conscious of that. It's almost like stock, right? Like, where, we had a big event this weekend. That means 2 weeks, we might see the results of that. We might see it, big business closes on a deal where we expect their stock to rise. Sadly, we expect the numbers to rise as this gets going, unless it's seasonal, which we're hoping it will, because it'll buy us more time. But again, we don't know. So, all right, Mr. Bell, we got you for the update on possibly creating a webinar for self-employment, and then we'll continue the floor with yourself for talking about loan forgiveness workshops as well.
All right. I'll just go right into our webinars at the moment have all been around raising awareness of the PPP program. We've done webinars in recent weeks with the Kansas Small Business Development Center. I believe we've done probably since our last meeting, maybe a total of 2 or 3 of these such workshops. And again, as I mentioned, we've got the June 18th workshop coming up for the Hispanic Chamber. I think it would be a good idea, and I'll be working with my group, and certainly we're open if there's interest. But I think it would be a good idea to do another webinar on the topic of the PPP program, because the application deadline is June 30th. A number of businesses have already, taken advantage of this program or had the opportunity to take part in this program. Just to give you the numbers in our area right now, total of over $2.4 billion in terms of PPP loans have been made between April 3rd and June 3rd. And in terms of the numbers, it's nearly 23,000 of those loans that have been made in our district territory, which it goes beyond the Wichita MSA. We cover all 77 counties west of Topeka, but it gives you a sense of, there's pretty much widespread usage of this program. I think it's really helped. There have been some changes here recently in terms of the loan itself was intended to cover 75% of payroll costs for a business and 25% of indirect costs. Well, that's recently been changed, and now those numbers are 60% of the loans are to go towards payroll costs, with 40% going towards some of the other costs, such as rent or lease payments. And all of this, if the borrower abides by the guidelines, all of this becomes a grant. So it's been a big deal, I think, and another tool that's been available to help business owners. So anyway, I'll pause there in case anyone has any questions. But the one thing I would emphasize is that we are certainly interested in doing another webinar around the PPP program, prior to the deadline of June 30th.
Okay.
We
Any
listened.
questions on that item? Ms. Beck?
So I listened to the webinar that they had last week, and it was real helpful as well. And then, they just changed guidelines again, kind of here recently. So I don't know if doing an updated one now, because I think now it's 60% has to be used on
Right.
wages.
Right. For sure. I totally agree. I think it would be a good idea to do another session or two that includes the updates, prior to June 30th. So I'll put out some dates. I'm certain that my group has already, identified a few dates prior to that, and so I'll be sure to send it around so that Dee can get it to the group and we can get it disseminated. But if there's interest in doing anything beyond what we put out, you guys let me know, and we're happy to do it.
Okay. Emily, was that you adjusting the
Sorry.
camera, or do you want to get the floor?
Oh, no, I was trying to unmute myself.
Okay.
And Wayne, on that topic, and I'll maybe just email you. It would be really great if there could be some kind of help with individuals, like I think I mentioned before, like hairstylists that are, self-employed. Like, for instance, I have an 80-year-old stylist that still cuts hair that I think she had emailed you a while back. She's very confused about the whole PPP thing. I'm gonna get her email and I'm gonna send it on to you again. She's still working, but this is overwhelming to her. But maybe something gearing towards some of those individuals that aren't in a situation that they have the resources like I do, where I have a bookkeeper, an accountant, a bank I work really closely with, because they're just an individual. So
Right.
something like that might be really great, because our industry is still, we're still obviously trying to get it together. Still no self-employment, and the unemployment has not come through for any of my staff yet. So anything that they can still get in contact with before the 30th would be great. So I will email you, Wayne, and at least give you her information.
That'll be great. And yeah, if you'll send that to me with her phone number, I'll follow up with her, or someone will sometime today for sure. Because this is, it essentially becomes a grant, and I know the difference that can make for all of our businesses. So, yep.
Yeah. It's made a huge difference for me, for sure. So, okay. Thank you.
Any further comments? Kara, you going to the mic? No? All right. Scanning for movement. All right. Anything else on those two items? Very good. We'll move on to the next on the agenda. And Kara's up. She's going to talk to us about job vacancies with Dress for Success, and sharing those job vacancies. And is there anything else we can be doing better?
Yeah. So pretty much still, it's all still the same. I've gotten in touch with a few more businesses who have some availability. So again, just another ask to the community. If you guys know anybody who's hiring, if you yourselves are hiring, our ladies they work in all industries. So seriously, it doesn't matter what the job is. We probably have somebody who's looking for something and would be willing to fill in that spot. So if you guys know of anything, it would be really great to know. We've been kind of, searching through LinkedIn and things, or not LinkedIn. LinkedIn's good too. Indeed, searching for different openings in the area. I just want to reiterate, we are not a job placing agency. We just, we are a job seeking agency. So we, let our ladies know these are the positions that are available. Go ahead and apply for them. And then of course, if we have connections, we can just, let them know, like, hey, just be aware of this resume is going to be coming through at some point. So, and that's pretty much where we're at right now.
Okay. All right. Any questions for that item?
So Workforce now has been putting out almost daily updated posts on jobs. So if you're looking for a job or have job seekers, Workforce is the better option to go search for employment, because theirs is updated daily versus Indeed. Actually, Indeed is taking job postings that it has seen and trying to sell those postings to the company. So it's more up to date on that. And if you find a job on Indeed, it could already be gone by the time, because they only update their website once a month. So job could be gone by the time you apply. And Indeed's going to be like, hey, we have, 10,000, or 1,000 people interested in your job, and they're going to go sell that to that company. And if you're not willing to pay for it, you don't get, then your application doesn't get put in. So Workforce now is putting out a daily job placement. So that's where I would suggest if anybody has jobs to place them with Workforce.
Thank you.
I need to get in touch with Workforce and get an update. I think that was a lot of my focus first coming in, particularly with the layoffs. And then, I haven't touched base with everything that's going on over there since I think Corona's pretty much been a top of the list thing. So Thanks for that update. And that's a good reminder for me to actually get in touch with leadership.
And they're just now getting back into the office. They've been working for a while, but they're now starting to see people by appointment. And so they're starting to gear back up as well, knowing that, the Spirit announcing another 900 furloughs for the next 21 days starting on Monday, they're starting to gear up to help those individuals as well.
Okay. All right. Very good. I'm glad they're getting back going, and we'll have to reach out to them. Any other discussion on this topic? See, none. That gets us back into our childcare support and needs for report on options available to support parents in returning work who are returning to work. It's been 2 weeks since we talked last. I think that people are getting more comfortable getting back out there, for better or worse, right? Has the situation changed? Are we still? What are you guys hearing as far as some of the programs that I think people have been dependent on that might not be there anymore or might be opening late? What's kind of the pulse of the community on this since last time we talked? Are we seeing more options, or is it still as bad as last time? What do you guys think? Carrie or Ms. Beck? One of you guys, Ms. Beck, you're shaking your head yes. Go ahead. And
So DCF has announced some placements also. I get weekly emails from them about programs that have opened up. USD 259, their summer program went so fast that they had to readjust, try to make some more opportunities for parents as well. And a lot of the community centers now have been opening up their resources as well, and camps. So there is a lot more options out in the community right now. And some of the places that weren't doing and have not done programs in the past are now stepping up. There's other nonprofits that are now adding a summer program because they can find funding due to COVID and, in response to COVID and get funding for it. So there's programs that are popping up that would not have been there previously. So
good
sources now.
So the CARE Act's money is probably trickling down to them.
Yes. And then there's been a lot of corporations here lately also that have, have had opportunity for funding if it's related to COVID, if you can relate it to COVID. Evergy had made an announcement, Kansas Health Foundation had one as well. Had one, Cox Communication had one. Those are just some of the big corporations that are in response to COVID and are providing additional funding from that as well. And also the CARES Act as well is also taking into effect. So there's more programs that are opening up.
Okay, so hopefully things cautiously and safely, but more opportunities are becoming available. One of my biggest fears is that, and I think we're kind of all on the same page, or most people are on make sure opening safely, because as soon as if we find out that a cluster breaks out at let's say a kids soccer program, then all the soccer programs are shot at that point. Like no one's going to put their kid in there if it's not being practiced safely. So let's hope that people are still taking these precautions. It sounds like I think they are. Like I think that most businesses want and organizations want to not be on the news for neglecting their their clientele. So that's also an incentive. right beside the incentive of keeping people healthy. So I'm sure that there's multiple reasons for that. Other people who would like to speak to this topic, I mean, hopefully we'll keep moving forward. I'll try to keep my ears open as we open up as a city as well. We're doing so very cautiously, but we're following CDC guidelines. And I think that's CDC guidelines are kind of the standard, right? Where you're following CDC guidelines and you're not trying to, deviate from that. It offers you a level of protection, I think, legally and, just even somewhat morally, where you're listening to the advice of the experts. So that's what we're doing at the city level. Although and I'll just tell you, we're in budget talks now. We have to cut $11 million out of our budget for this year alone. I know, and that's not like little stuff, right? And it's interesting discussions where, and I don't know if I gave you guys an update on this. For example, the pools. The pools are a very tough topic right now because that's about $300,000 that if we don't open the pools, we could save. We already have to kind of shorten the session anyways because of COVID. And then there's also some correlation with the timing where we open a session for pools and close them. It correlates with the training of lifeguards, and usually when lifeguards go back to school. So there's just some complications that have led us to possibly, hopefully Congress will do something and actually help us with our budget deficit. But if not, we have to make some of these tough decisions, and stuff like pools are part of that, where if we open for a half season, it costs us this much, but if we keep them closed, we save that much, and we don't have to close other programs, and we can speed up the repairs, phase 2 of the Aqua plan, to speed up repairs so that when they do open, they'll be fully open. So we're having those talks right now at the city level. But some of the programs that other people have enjoyed over the summer, the talk is twofold. First, is it safe? And then also kind of budget talks. And by keeping them safe, by having them close a little while, and then do we open them towards the end, and what is the cost benefit analysis of that? That's the type of conversations we're having. But I do want to prepare you guys, as parents, as people in the community who talk with parents, that some of the programs from the city level that normally might be dependent on might be adjusted, or in some sad situations might not be happening, either for health reasons or for finance reasons. You can't cut 11 million out of our budget without it being noticed. I mean, some things are going to be easier than others. We have like $150,000 we use to plant trees. For the next 2 years, we're not going to plant trees, right? So I rather keep, we might, and hopefully we don't have to go that far, but I rather keep like libraries open and kid programs open than tree maintenance or replanting trees, in some of our areas. So we're looking at stuff like that where it's going to be noticeable. We're getting a lot of questions about grass growing, because I think we might actually put out like 2 weeks longer for grass, because it's going to save us like hundreds of thousands of dollars if we do this. That's the type of stuff we're talking about. And I think it's going to be more of a nuisance type, where why does my grass have to be mowed but yours doesn't? Like, those are the conversations I'll be fighting off on Facebook, like literally like all hours of the night. But the more concrete stuff, the stuff that people depend on, that's I think our young people programs, we're still in talks to see what's going to move forward and what's not. And I just wanted to give you guys an update that the talks are twofold. It's safety and budget. And we can't print money. We got it. We have 11 million to cut this year on projected deficit next year of 16 million. So yeah, which, coming in as mayor, being from the Brownback administration, like, I'm not from there, but kind of legislate under that, where we always had a budget crisis. Like, I thought, like, it's going to be really great to have a balanced budget, come in and not have any, we're going to be able to do all this great stuff. And, I'm going to be able to scrounge up some money for different things, because that's kind of what my training is. And now it's like, nope, you're also in a crisis. And apparently that follows me around. So sorry about that. Okay, onward. Let's see if there's any questions about that. All right, see none. So we just talked about childcare, and I gave you guys super depressing information about our programs. Facebook group has been created. I'm going to cross this one off right now. Boom, done. You guys are welcome. No kidding. So Megan supposedly just went and okayed everyone who's requested to be on. If there is someone who should be on and they're not, go ahead and send them a request. I think we got it to everyone because we shot out the email. Just keep in mind that the Facebook group is likely public, and it's likely subject to Quora. This is a public meeting, of course. Sometimes I think on social media with some of the groups, people might get a little more comfortable posting stuff. So just be cautious that, treat that like a public meeting, pretty much. So we'd love to see pictures of your kids or whatever. You can post those, but let's treat it as a public meeting just because we want that to be able to reflect the group the best way it can. Any questions on the Facebook group?
I'm not sure you see the chat.
There's a chat? No, I haven't seen
Yes.
that. Yeah, let me.
Okay. Well, there's a chat going on. And one of the questions was, what's the name of the Facebook page? I'm not sure I'm on it. And that was from V.
The question was,
Say
what's
your
the name of
name
the
right
Facebook page?
Yes.
Megan, what's
It
the
was
name of the
me.
Facebook page?
I'm just not sure I'm on the group.
Okay. Megan, would you come here, please?
It's just the name of it's just called Mayor's Small Business Advisory Council.
Okay.
Okay.
Yeah, is that all it is? Small Business Advisory Council for the mayor.
Yeah.
See more.
Yeah, it's still showing me as pending on that.
Who, Ian? Ian
Yeah.
needs to go to groups. It's the one with the G, right?
I guess, can somebody just invite me, please?
Yeah, I'm opening up right now. I got Megan with me, so.
More,
More.
and then say manage requests.
Manage request. This is a lot of clicking, Megan.
I know.
Oh, let's go to improve Ian.
There you go.
And yeah, we're
Few
gonna
seconds,
improve
go.
Eddie.
Perfect.
Boom, boom. All right. And who just said that they need to be added?
Invite them.
Say,
Faye. Okay. So invite.
I need to be added also. I just, I didn't know about it either. So I just clicked to join.
Okay.
And you can invite members there.
That's not what. Oh, invite members here. So let's do. Faye. That's right?
Yep.
Faye, you should have just got one, and then also Emily. Did you say you need on this?
thank you.
Okay, so Emily SH.
You can only invite friends. So
I can only invite friends. Why are we friends on Facebook, Emily? I can only invite you as a friend. Let me. We'll send you an invite through the email then. Well, Megan does. Sorry about that. Is there anybody else who's not on who I can just add you right now? Okay, cool. Emily, we're gonna get you on. Apologies. I need to be a better millennial, but we have Megan, who's the greatest millennial at social media. You out of here? Okay. I'll see you there. All right, cool. Next on the list. Any questions about Facebook? All right, so last item is opening closing cycles, discuss how to improve business community, move from reactionary to preparedness mode by working with the Board of Health. I think that some of the stuff we talked about has been kind of overlapped with this, and it seemed to be focused on getting information out, particularly getting information out in different languages, and also the work of Mr. Bell with some videos. Is there any other stuff that we can talk about to integrate some of the information for the Public Health Board or the CDC that will help prepare small businesses for any of the cycle changes? And one of it too, I think that we should probably just put out, and maybe this is something that we can keep adding to our website. We might go backwards, right? Like the county's Dr. Nims, their health professional, talked about maybe going back to phase 2, and as the numbers change, there's potential to go back, and I think that it might be, have a plan B for not being reactionary but being prepared. Like, we're okay if it goes back, get people ready, make sure they have PPE. Is that what do you guys think? Is that is there
I
more
do.
we can do with that?
I do have something on that. Having
Okay,
been closed for 8 weeks, that is a question people ask us: is what happens if can they close you again? Will they close you again? And I don't have an answer for that, which is obviously terrifying to us as we try to recover from this. I mean, is that something that could possibly happen?
So there's a couple things with that, and I'm gonna preface where like yes and no, everything's possible at this point. Is it likely? I'll tell you, there's a couple variables that just through my training in politics and government that I'm going to my observation for what it's worth. It seems that the county is utilizing voting on recommendations more so than on hard enforceable type policy. So, for example, they didn't recommend that everything just open up. They just said, businesses, we recommend that you follow the governor's task force guidelines, but we're not going to enforce it. And because it's unenforceable, it's a recommendation, everyone just opened up, right? Like I did 30 going here, coming from here, and it's because it's the law. It's because if it was a recommendation, I probably would have drove faster, right? So we don't do well with recommendations. I think when it comes to particularly stuff that our livelihood depends on, which is our businesses. So, but with that said, that seems to be the trend right now, where the county is doing these recommendations, and by following that, it allows, I think, business owners like you guys to actually be prepared. Where back in phase 2, what were the recommendations for us to do in phase 2? And it kind of gives you, those guidelines are out there. It just, I think, kind of puts the ball in your court, in the court of small businesses, when it comes to reacting, because it's asking you guys to react on your own instead of being forced to react or being forced to respond, which is fine if it works. And I think that Wichita's in a really good spot with the COVID virus. As of today, we were supposed to have, like 200, 300 deaths according to the modeling. It was because weeks before the governors closed down, pretty much the state, and even before the county did with stay-in orders, we're passing out good information and people are doing it on their own. Like people already knew. So I think that kind of theory is what's in play here. Is if we give people the right information, they'll do the right thing. It's just getting that information out, letting people know like where we're at, and letting them know the difference between spike in the numbers in the hospital and hospitalizations and spike in just numbers of positive testing. So we're testing more. So you're going to see the numbers go up, but does that mean we have to, resort back to this or that? It really is going to be the recommendations of the health professionals, I think, and making sure we don't let our guard down. It's going to be, a lot of people are going to want to let their guard down. Like psychologically, you want to believe, and it's just like Emily said, like it's scary. People want an answer. We are, in our culture, we're very good at predicting things, right? Like we can predict the weather. We can predict, we have people who can kind of predict the stock market. Like we can predict this or that. The virus makes a timeline. It's unpredictable. We're not sure. It falls a little bit on our behavior, right? Like if we have a parade, then it's easy to predict that 2 weeks from then we're probably going to have a spike in the numbers. But we really, we're in a weird spot, I think, for us in our modern society where we normally have data, we have algorithms, we have stuff that are predictive measures. So I think we would have to see a real high number of hospitalizations before they start going back to real tightened policy, before we're sending the cops out to try to enforce the policy. Now I will say, and it's weird, like I'm not a medical person, but I feel like I'm an expert in COVID now, right? But I'm definitely not. One of the things that worries me, I'm just going to put this out there, take what it is, knowing I'm not a medical expert. If this is seasonal, okay, like if this follows kind of what the cousin bug does, which is the cold, and it's seasonal, we are going to have a false sense of security when we see the numbers drop this summer, right? Like we're going to assume, oh, COVID passed us, it's over. The news media, everything else is going to be out of sight, out of mind. And then it might smash us right when cold season happens, right? Like boom, we see a spike again. So we I think someone be prepared for the worst on that. Hopefully by then, we won't have a vaccine by then, I don't think, but hopefully we'll have a good treatment, right? Like that's the other thing we're waiting on is what is the cocktail of antiviruses that, and we have companies working on that is going to just knock this thing out as soon as you have it. better treatment. That's the other thing we're worried about. So hopefully we'll have that by then, right? Like, because that will buy us some time. But we should be cautious of the idea and probably planning in your business strategy if we get a spike during cold season and this, we have to close some stuff down again, then what does that look like for you? So just a warning, hopefully it never happens. Hopefully that's not the case, but it's one of those that some of the healthcare professionals I'm on the phone with are talking about, is if it's seasonal, we might see something like that, which would trigger a government reaction. It might not, it's election season too. Like there's a lot of variables.
So I know we're talking a lot about, doing webinars about the PPP loans and all of the things, but I think the one thing we're missing is what you're talking about, is being more proactive as a business owner, and making sure that we can, we're setting money aside if there is that ability, or if and when we have, I'm not sure that we would make it through another long shutdown. I don't know if anybody else, continue to operate during that time, but we heavily rely on the community as well. So, I just don't know, if there's best practices that everybody's found out to be more proactive. I'm not sure.
And that might be something we want to discuss, think about and discuss on the next meeting too, where what did you want to know like 2 months before this happened, right? Because this was unprecedented. We have no blueprint. We compare it to like a flu pandemic, which just isn't a flu, right? And that's, it's worse. But what would you have liked to know in December to prepare for March? And kind of put that together. I think that's actually a really good idea. Because one of the problems just with planning, and everyone on this call knows this, where you never want to be setting up the plan as you're going through it, right? Like you never want to build the airplane while you're in the air, right? So you can, but usually it's exhausting and you're more likely to make mistakes. So having that plan and maybe having that discussion next time around as we can ponder this a little more about, okay, if we go to this and this would be the trigger. We're going to furlough these people. We'll have to not contract with these people. My goal is to have a cushion of money that is this much in case that happens. And then hopefully you never have to enact the plan, right? Like hopefully being overreactive is probably,
we
or
sincerely
over-prepared is
appreciate
better.
your patience. Please
Is what?
stay on the line, and we'll be back in a moment.
All right. So the is that Wayne? No. So we need to. But yeah, I think that's a really good point. Is if this thing, how do we prepare for the market? And I don't mean the market as in it's like how you guys would prepare for the market, the ups and downs. How do we prepare for the legislative ups and downs where this thing goes up health-wise? The legislative response is this. We already kind of know what that would look like based on the current stuff.
Thanks for holding. We
and
appreciate
prepare
your
for that.
time and patience. Please stay on the line and we'll be back in just a moment.
Any more questions? But yeah, I think that's a good homework assignment for the next one. I think we're gonna get on someone else's call if we don't hurry up and end this. Like, we're gonna wind up on like, it'd be kind of fun though, wouldn't it? But anyways, yeah. Other comments and questions? We have other challenges. I think we kind of mixed that throughout this. We're about 10 minutes over, so we're about 10 minutes over, which means we're right on time. Is there if there's nothing else, then we'll go ahead and end this, and we could take I'll see you, D. Well, yeah, I see it. We'll just do a discussion online. Yes.
Me? Okay.
Yes.
I'm sorry. I just wanted to go back to, earlier we're talking about are the materials for testing. Is there someone at Health Corps? I contacted my friend out there. There's the communications person. She said they do have bilingual staff that can administer the test, and their materials are also in Spanish. So.
Excellent. Awesome. Okay. And when I'm doing my test at today at the county, I'll also inquire about that if I remember if I'm not tearing up too bad, and if I can utter the words out afterwards. Do you guys also have bilingual staff that can help? I'll check with that as well to see if the other facilities do. But thanks for following up on that. Anything else?
Alicia.
You guys are awesome. Thanks for hanging in there and helping us out. We'll take the discussion online for the next week, and Dee will shoot you out the minutes, the agenda for the next meeting, and we'll get back on in a couple weeks.
Mayor, can I just ask something just real quick that maybe we can think about talking about next time?
Of course.
Or at least online. I know Emily mentioned that she has staff that has still not received unemployment as well, or the PUA. I'm wondering if that's a topic that we can talk about, because that is a huge issue with a lot of people still. We're going through the same thing.
Okay, so and I can do a follow up on unemployment. I know they got smashed, but let's see if they're recovering. Let's see what's going on, because they just, let's try to get an update on that for sure. But I think you're right. That was one of the worst things with this, is that, you know, everybody assumes there's a social safety net, and that they pay into the system, and that system will be there for them. And then when you have like a 5,000% increase, you know, we learned things like they're using a 1970s mainframe that no one can figure out, because the only like 2 people who actually understand the code are living in New Jersey, and they're retired. You know, little things like that where the system was not prepared. But let me try to reach out, get an update with that office to see how they're doing and if they have any tips.
It's almost impossible to get a hold of them, whether it's email, social media, you know, and there's a lot of people that have complained too, saying they're just putting data out on social media. Well, not everybody thinks to look on social media for that. I mean, we're going on 11 weeks now, or maybe even longer for some people, where people can't get through, or they can't get answers, and people that should be getting it this entire time. I mean, it took me 3 weeks just to get it for my employees. You know, we've paid in for 10 years. So there's a lot of people who it has been just, I think people are starting to give up. You've got a lot of people who are worried about paying their bills, and it's actually just really sad.
No, it is. I'll double check. I can get through to them, because I lived in Topeka, and the legislature I'll make contacts to people who I'll call them thinking we're going to chat, and then ask them tough questions. So
that would be fantastic. Thank you.
Yeah. And I just will say that, you know, I think you're absolutely right, where in a legislature, just some history, was this philosophy that if we make it tougher, and some people actually did this, almost tougher to get unemployment, and encourages people to go out and get a job. It just literally was not, there was no idea that, like, what if the market is at a standstill? What if you can't go and get another job, right? Then, you know, they added these extra steps that aren't federally regulated, that aren't federally necessary, but they did it as this philosophy that, you know, like filling out the stuff every week is, you know, if you're going to do that, you might as well fill out an application. It's just really, not only was not set up for the volume, but also no one predicted that we would be in a situation we're in. So, and I'm not making excuses. I'm just saying that, they're going to have to reevaluate. The legislature will have to reevaluate what this program is, and how we can improve it, because it just was not. As someone who's been on the Commerce Committee, when they ran through bills to pretty much make unemployment tougher to get on, the whole idea was, you know, getting people to apply for another job. It was never considered like, what if we can't apply for other jobs? Like, what if you can't do Uber driving right now, or the bars are closed? So, anyways, big policy stuff coming up in the future, I think, with those guys. But
they've also added a question that wasn't on there previously now.
They added two, number 11 and 12.
Correct. It was our something in the context is were you able to work the last week without any undue restrictions? And then I don't remember the other one. That was just the one because
it was, were you able to work more than 4 days? And it's worded so terribly that most people were still going off of the COVID rules, and that's why they answered it no.
Right.
And it's supposed to be yes.
They are. Both of those are supposed to be yes. Yeah. If you don't read the questions correctly, I had to read it like 4 or 5 times to really understand what that last question especially was asking me. Because
agreed.
My husband file it because he was from Spirit. But yeah, they've added some questions and And it's almost designed to trip you up in my mind on that especially the very last one.
And like I said, I think that was the philosophy for a while, where
Yeah.
let's make it tougher to get this. I mean, we passed reform, I guess, and they touted it as welfare reform. But yeah, it was stuff like, some of it was smoke and mirrors, right? It was like, you can't use your cash benefits on a cruise ship. Like, no one's doing that. Like, what? Like, and then some of it though was, to shrink the amount of access you had to this so that people went out and worked. And that question alone, I doubt that. And that's the thing. Problem with legislation is it's slow, right? Like you want to give some, and I'm kind of getting into philosophy here, but you want to get some flexibility to the director, to the person running the department, where they could remove that question, right? Because can you work the last 4 days? What they're trying to do is weed out people who aren't seeking jobs, who can't work, right? Because if you can't work for 4 days, you shouldn't be on unemployment. You should be applying for disability. But in this case, like, you can't work for 4 days because of a executive order. The executive order didn't actually supersede the current statute, because they can't. So that now they're statutorily required to ask that question, and that question disqualifies you because when a question was designed, it wasn't designed with this type of situation in mind. So it's very interesting and terrible.
They just added it last week. It has not been there this entire time. A number 11 and 12. It's not been there the entire time. And they finally put on the KDOL's social media site, it says there are tens of thousands of people who answered the question incorrectly. And we are now trying to remedy this as a whole, because before you had to go back and try to find a certain form that you need to fill out and send in. But there are so many people because it's worded so inappropriately. And again, because they added it out of the blue, it seemed really inappropriate the way they did it.
Well, let me find some background on it then, because the legislature met since then. So maybe there is some reasoning that they did that.
Well, I think that question is intended to ask for undue restrictions is, is the doctor's requiring you to, are you not working because the doctor's requiring, or you have restrictions due to medical, or I don't know. It was worded awful, the very at least the very last one. But I really think that that's what they're trying to ask is, are you home because you can't work because you're medically bound not to work, which then that would disqualify you and you need to get short-term disability.
Okay.
Well, and I think they said those questions are normally on there. They had taken them off during COVID, and then they put them back on since the restrictions were lifted off and everybody supposedly was supposed to be able to go back to work. And that's why they added them back in. But everyone was just so used to going through and answering no. And then out of the blue, you have 2 questions that you have to answer yes. And not only that, but they are worded to where it could be confusing to people.
Mm-hmm.
Yeah. Okay. Let me double check on that. See if I can get some info from it. Okay. Well, that's disheartening.
And so it's been weeks. I mean, like I said, I have 2 people that there's some sort of glitch going on that keeps saying we need more paperwork. That makes no sense. So 11 weeks has gone by and they still haven't received anything. And I have one of my girls who just finally received all of her back pay last week.
And at the same time, we're seeing like a spike in evictions. I mean, there's a huge trickle effect to this that we got to get in front of. And it's annoying because it's intergovernmental, right? Like, it's annoying enough where we have to work with the county to get a lot of stuff done at the local level, just because it's just another body we have to migrate through. Working with the state adds like another barrier to that. So it's something that we can look into. Let me make some calls, see what we can do. I know they're working on it. I do know that when we had the layoffs, for instance, they were able to Spirit gave like an Excel sheet and they uploaded it all in. So everyone was automatically, who was being laid off was automatically approved or submitted. And when I talked with Secretary Delia Garcia, she, said like, oh, it's really important because we don't want to be overrun, and we were only talking a few thousand people then. So it was, to make sure people know not to go to the website and if they're on that Excel sheet, because it will crash our website, will be overrun. So, and like I said, we were talking just a very small amount, of people at that time. And then fast forward when we see, depression number, or at least Great Recession number of people out of work, that was the scary part. Is I bet that absolutely just blew up the website, and it did. I mean, we learned. So, but let me follow up and see what's going on. Also, like I said, they took off those questions, and now they have to put it back on. There might be some legalities going on that it's just the system was not designed for this, and it was held together by duct tape to begin with. So, but I do know the people who are running it. They're good people, and they want to provide the service. They're not finding ways to keep people out. So not that I know of. So we'll move forward with it. And so I wish there was something I could do, right? I wish being mayor gives you some power, but not enough to fix a statewide system. But let me see what we can do to get an update on that, and maybe some tips or tricks, right? Maybe, if you do it this way, we can get to it better. So, for example, they don't want people calling. They want to do it online, but then our website's also limited. So, anyways. So we'll check on that.
That would be great. Thank you.
Okay. Anything else, guys? We exit out. Thank you all for being awesome. We'll take this discussion online, and reach out to me if there's anything I could be doing in the meantime. So thanks a lot.
Thank you.
Thanks. Have a good